Ask the Messengers, the program that deals with substance abuse, real people telling real stories. Where there is addiction, there is a chance for recovery. We're trying to help save lives on Ask the Messengers.
Today on Ask the Messengers, we go one-on-one with Chief Public Health Officer for the Detroit Health Department, Denise Fair. She is here to share with us her role with the Detroit Health Department and to tell us about some of the resources that are available to the Detroit residents. Plus, Ask the Messengers team had a few questions about the COVID-19 vaccines, and she's here to answer them for us. Plus, real people share real stories. Ask the Messengers begins now. Thank you again for being here with us today. And I want to congratulate you on all your accolades. I heard you got an award recently. You're a powerful woman in the community. That's what the word on the streets is anyway. So congratulations on your Woman of Excellence Award. That was your Michigan Chronicle, correct?
That's correct. Thank you so much for the honor. Mm-hmm.
So tell us, who is Denise Fair and why do you do what you do? And what keeps Denise motivated to do this every day?
Wow. So Tina, that's a wonderful question. I believe I was placed on earth to do just two things. And when my time is up, my time is up. I believe I was placed on this earth to inspire and motivate people to be better versions of themselves. And when I think about health, health is so very important to us as human beings. And I want us all as Detroiters to focus on being healthy, both mind, body, and also spirit. I am energized by the work that I do every day. My job as the health officer is to provide health and wellness for 700,000 Detroiters. And I can't do that without my team of 250 people who are working so hard to make sure Detroiters are protected. So it's a fun job. It's a rewarding job. It's many, many hours. And I'm honored to lead in this capacity.
Tell us what resources are available to the Detroit residents for people who just may not even be aware.
So the vision of the health department is to ensure that we create healthy communities so that Detroiters have the opportunity to thrive. And we have over 40 programs designed to do that very thing, which is to really help you thrive. And so some of those programs, I'll just highlight a few of them. For healthy outcomes, we have a really robust WIC program designed to help mothers and their newborns, whether they need food assistance or diapers or any other types of support. We have a program specifically for mothers. We also have Sister Friends, which has been around for a couple of years, and it's a great program for mentors who want to help women who are pregnant, help them get to their doctor's appointments, give them just some guidance along the way. And so we're always looking for mentors. So Sister Friends is really a wonderful program. If you have a child and they need their immunizations, we have a clinic where you can just come in and get all of your immunizations, including your COVID-19 vaccine. And we also have vision and hearing. So if you are under the age of 18 years old and you need a vision test or a hearing test, you can come to the health department. We also have safe housing and neighborhoods. So we have a lead program. So a lot of the houses in Detroit were built before like the mid 1970s. And so we want to make sure that your kids are safe. And so we have a lead abatement program. We also have an environmental health and food safety. So every restaurant in the city of Detroit needs to get a business license. And we have the health department staff going to all the restaurants to inspect them to make sure that when you go and eat at the restaurant is safe. And we also have an animal care shelter. So we have officers who are out in the street and they are finding stray dogs and cats and bringing them into our shelter. And then we have an amazing adoption program as well. And finally, for our community outreach, we have a behavioral health team focused on substance use and also community health services. So as you can see, we have a lot of programs in the health department. We're just waiting for you. Come to the health department and get the resources that you need to thrive.
When the pandemic hit, tell us a little bit about how the Detroit Health Department had to make those really quick adjustments from doing your day-to-day in person to now we have to be COVID compliant. So how did you guys adjust?
Absolutely. So when COVID hit, this was all hands on deck. And so we could not provide the service that we were comfortable, that we were used to providing, directly to the public. So a lot of us had to go virtual. We had to modify all of our programs, but specifically for COVID, the first case hit us on March 11th, and our world changed. And we had to be quick with our strategy. We couldn't just sit around and figure this out. We had to just get things done. And it was definitely a partnership between not only the health department, but multiple city departments, schools, churches, businesses, hospitals. We all came together to beat this virus. And of course, our work is not done. Within the first couple of weeks, we lost close to 300 to 400 of our close neighbors and friends. I mean, it was devastating. It was a traumatic experience for the health department, of course, for the entire city. And our job was to make sure that we communicated the importance of COVID. We educated Detroiters in a variety of different ways. So on social media, in press conferences, in the news, on Instagram, because we had to get the word out there. And we made sure that we focused on emergency preparedness because this was an emergency and we had to be prepared. We definitely were, and I believe still are, a national example for how to get things done when there is a crisis.
Mm-hmm. So, throughout the city of Detroit, there's always been a epidemic, opiates, drug addiction, things of that nature. Tell us a little bit how the health department, did you guys see an increase of need, or did it kind of, everything went on shutdown? So did the people begin to shut down and not seek help as much? I guess that makes sense.
So I think what we did see was people wanted help. They wanted to understand what COVID is because they were getting so much misinformation on social media. Yep. And so I'm really proud to say that Detroiters came to the Detroit Health Department because we are a trusted resource to Detroiters. What we found is that Detroiters needed resources. They needed access to food. They needed access to water. They needed access to just, we developed this 24-hour hotline because we wanted Detroiters to call in and ask questions. So again, this was a huge partnership. One of the things that we did was we focused on those who are living in congregate settings, and we wanted to start testing individuals at nursing homes and also homeless shelters. And so we went directly to them. We partnered with Wayne State University, and we got some medical students to help us go out into the field to make sure Detroiters were protected. In fact, we tested over 2,000 nursing home residents within about 10 days, because again, we couldn't just wait. We had to go to where the people were to get them tested. And now we're following that same approach when it comes to the vaccination.
I got you. Now, speaking of the same approach, now we are a year later, and we're going to take a break. And when we come back, some of our staff for Ask the Messengers had a couple of questions to present to you in relation to vaccination, the importance of vaccination, understanding the conspiracy theories of vaccinations. You know how we do. So we are dependent on the expert, which is yourself, to answer just a few questions from our staff. So when we come back, we're going to answer those questions. Is that okay with you, Denise?
That sounds like a really good plan to me.
All right. This is Tina Nelson for Ask the Messengers. And when we return, we will have questions from our staff for our guest, Chief Public Health Officer for the Detroit Health Department, Ms. Denise Fair.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available.
You can pay online by visiting the Wayne County Treasurer's Office website. Paying online is easy and convenient.
You can also download the mobile app and pay with your smartphone.
You can pay at one of 70 kiosks located throughout Wayne County.
And yes, you can always still send in your payments using the U.S. Postal Service.
If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or mask is required and social distancing is observed. Your health and safety is very important to us. You can also email our office at textinfo@waynecounty.com or call us at 313-224-5990.
Hi, my name is Artesia Washington, and I'd like to welcome you to Irvine Neuro Rehab, where we help you reach your goals of rehabilitation. So you ask, why choose Irvine? Now here at Irvine, we offer physical therapy, occupational therapy, speech and language pathology, counseling, aquatic therapy, and massage therapy, and we help build you back to your previous level of functioning. Give us a call, 248-415-2500, www.irvineneurorehab.com.
More than 2.5 million Americans are addicted to opioids. The addiction is sometimes developed through the improper use of prescription painkillers. Using prescribed medication in ways or amounts not intended by a doctor is very dangerous. So it's important that unused prescriptions are properly disposed of. If you or someone you know is struggling with addiction, or for more information about prevention, treatment, and recovery services, or how to properly dispose of medication, contact the Detroit Wayne Integrated Health Network, 24/7, 800-241-4949. Here to talk, here to help.
If you or someone you know is battling with any type of cancer, you need to read the book by Laverne Moore Slaughter, God Encounters Are Real. In her book, she tells how through prayer and faith, God healed her and set her free from stomach cancer. For more information and to get your copy, visit www.encountersarereal.net.
We are looking for women in Detroit to volunteer to be a sister friend to a pregnant mom.
Hello, Detroit. My name is April Hill. I was introduced to Sister Friends Detroit as a result of seeing Mayor Mike Duggan's State of the City address. I had recently retired and was looking for a way to inspire others. I went on the website and applied, and after being accepted, I was soon paired with my little sister. When we met, she was in her second trimester, and I was able to be a part of her journey throughout her pregnancy and for her delivery. She is a wonderful, intelligent, and very independent mom who has allowed me to be instrumental in her family's life. We've been able to share mom stories, and as a result, the relationship and friendship has been very rewarding. I implore all women in the city of Detroit, if you have time, consider becoming a sister friend and create memories that will last a lifetime.
We are back, and for those of you who just tuned in, we've been talking to Chief Public Health Officer for the Detroit Health Department, Denise Fair. She has shared with us her role and some of the resources that are available for Detroit residents. Now, for a few COVID-19 questions from our staff. Denise, are you ready?
I'm ready.
All right. First up, Derek T. He's our executive assistant, and he would like to know, for minors who are not eligible to get vaccinated, is it important at that point for their parents to get vaccinated to protect their children?
So yes, it's really important for everyone who is eligible to get vaccinated. That it's going to help prevent them from going to the hospital, from getting COVID, and maybe even dying. So it is really important to take the time to get the COVID vaccine. There are three. There's Pfizer, Moderna, and Johnson & Johnson, and all of them are safe, they're effective, and they are free. And in the city of Detroit, it is so simple to get vaccinated. There's multiple locations, whether you want to go to a TCF center or the church or schools, businesses, we'll even come directly to you. We have a home visiting program. Just give us a call, 313-230-0505. Schedule your appointment or walk into any one of our walk-in centers.
Great. Now, our street reporter, LaShawn B, asked, how can we help the city of Detroit's homeless and people suffering from substance abuse to get vaccinated?
So every Detroiter is important. We have not forgotten anyone. And so when I think about people who are experiencing homelessness, those who are experiencing substance use, it is important that we also prioritize them. Now, in January of this year, we made it a priority to make sure that those who are in homeless shelters, those who are in nursing homes and senior apartments, we made sure that we vaccinated them first. And so it is an ongoing protocol for us to go directly to homeless shelters at least every couple of weeks to get them vaccinated. So that's really, really important. Again, we don't want anyone to be forgotten.
Thank you. So Derek H., he's our PR person and marketing director. He would like to know, are teachers required to be vaccinated? Because that's how we shut down, had to close the schools down first. So now we're ramping up to get ready to come back to school. So are they requiring teachers to be vaccinated?
So I want everyone in the city of Detroit to get vaccinated. That, again, is so very important, especially for teachers. They are around the public all day, every day. And so it's really important for them to take the time to get vaccinated. I know I've had multiple conversations with Dr. Vitti, and he's been so receptive of encouraging all of his teachers to get the vaccine. Once again, there's 3 vaccines. They're all safe. They're all effective. And it's really important. Don't delay. My encouragement is, if you are still on the fence, get educated. Don't go to social media to get educated. Come to the health department. We have doctors, we have nurses, we have experts here to answer all of your questions.
I was going to talk about that hesitancy, but we'll save that. Let's get through the staff questions first. That's a whole nother show within itself. And now George A. wants to know, how effective are vaccines against the new variants of the virus?
So that's a great question. We are learning so much about the Delta variant, which is still very new. In fact, in the city of Detroit, there's only a handful of cases of Detroiters who have the Delta variant. We do know that it's strong. It spreads a lot easier than some of the other variants, but it's still very important to be protected. There are multiple reports based upon Pfizer, and the Pfizer vaccine, which is, I would say, the most common vaccine, it's 93% effective in reducing hospitalizations and also illness. And it's about 64 to 88% effective in preventing any infection. Moderna also has a similar effectiveness, J&J as well, but there's just not a lot of reports right now about the Delta variant. Again, my encouragement is, don't delay. Get the vaccine now, and it'll prevent you from getting sick, from going to the hospital, and dying.
Okay. Now, I would like to know, how many people do we need to be vaccinated in order for the population to be considered protected? You know, that herd immunity. When do we get to that?
Hopefully soon. So right now in the city of Detroit, we're right about 40%. And so in order for the entire community to be protected, we need to get to 70%. So we unfortunately are not there, but I'm hopeful. I know that if we continue to spread the message about the importance of getting the vaccine and also answering everyone's questions, we can get to that 70%. So again, I'm hopeful. My fingers are crossed. Yes. I just, once again, the city of Detroit, we have, I believe, done a phenomenal job of making sure that everyone who wants to get vaccinated can. But now people just need to make up their minds that this is the right thing to do. But again, if they're hesitant, give us a call. We want to talk to you. We want to answer all your questions. So we have a hotline. Call us 313-876-4000. We'll answer all your questions.
Wonderful. So Miss Denise, we're going to take another break. And first of all, thank you for answering those questions. And I hope that gives you a little sense and put your mind at ease a little bit more, because we really need to get to this, because we do not want a repeat of 2020. We don't want to repeat. That's number one. So when we come back, we are going to have final words from Miss Denise, and she's going to give a few words of encouragement And we're just going to have her speak from the heart, from her, that as our street reporter says, what comes from the heart touches the heart. So we're going to have that moment. This is Tina Nelson with our guest, Denise Fair, Chief Public Health Officer for Detroit Health Department. We will be right back with more on Ask the Messengers.
This changed our lives dramatically. I haven't seen my parents in the whole year of 2020 to keep them safe. And so once I heard the shipyard was getting it, I was encouraging some of my fellow shipbuilders. Has probably heard me talk to them about the importance of this. And I know there's some reluctance in the minority communities for various reasons, but looking at the effects of the pandemic across the world and our communities, I have one close friend recently lose both of his parents, and within 2 or 3 months. And they did not obviously get a chance to take the vaccine. And what if, right? And so the vaccine is so important for all of us so we can move on with our lives and move on.
The world is opening up, and when it opens, you want to be ready. Concerts, clubs, weddings, dinner with friends, or just hanging out. Soon, Detroit will be back, and you know how we do it. For 3 decades, Fashion International has been here when you needed to look your best, and that time is coming again. Check us out now. We have the latest styles to have you ready for the new normal. Fashion International, 10 Mile and Greenfield.
Underage drinking is responsible for more than 4,300 deaths of youth annually. DWIHN, along with its provider partners, strive to educate young people on the deadly dangers of alcohol use and abuse. We teach youth about the dangers of drinking, especially when driving. If you are looking for resources to share with your loved one, give the Detroit Wayne Integrated Health Network a call, 24/7, 800-241-4949. Here to talk, here to help.
Hi, my name is Brenda Owens. I work at Greenfield Hair Collection, and I love doing hair. I've been doing it for almost 30 years now, actually. And I do a little bit of everything. This style right here is a pin curl. This is my weekly client, Denise, short and sassy. She just got a fresh haircut last week. The name of the salon is Greenfield Hair Collection. We're located on Greenfield between Outer Drive and Curtis. I'm on the 2nd level. My name is Brenda. My phone number is 313-729-8194. Give me a call. I love what I do.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available. If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or mask is required and social distancing is observed. You can also email our office at taxinfo@waynecounty.com or call us at 313-224-5990.
Hi, I'm Mason. I just got my shot, so I'ma still stay 6 feet apart, keep masked up, wash my hands. I've been vaccinated. Now here's what I want to say to you. You get vaccinated too. Then we both can go out and do and play the way we want to. Mason, from the Detroit Pistons and 105.9 KISS FM.
There's something that our street reporter, we call it a hope shot. Words of encouragement. Speak to right directly into that camera. And what we say, what comes from the heart, touch the heart. So right now, just take us out with some final thoughts, words of encouragement. What would you like to share with the viewers right now?
So I take my position very, very seriously. And I believe I was placed into this position to really make an impact on the city of Detroit. And so I had no idea what I was signing up for when I took on this job in September of 2019. But it has been an honor and a privilege every day to serve as your Chief Public Health Officer. What I will say in terms of encouragement to all of you who are watching is I want you to rise up. I want you to own this. You know, we are all in this together, and I want all of you to be a part of the solution by getting vaccinated. If we get vaccinated, if we get to 70% community immunity, we will be safe as a city. And I'm counting on each one of you. You know, I was looking at the data the other day, and 57% of Detroiters who were unvaccinated are under the age of 40 years old. And that's my generation. And so I'm speaking to all of you. Take the time to get educated. If you have questions, give us a call. We want to answer all of your questions. We want to address your fears. And once again, it's really up to you. I'm looking at you right now. And it's up to you to make the right decision to get vaccinated so we can get back to normal and we can get safe. And again, this is all about thriving as Detroiters. I want you to get healthy, be well so that you can thrive.
Thank you so much, Denise. And again, thank you for taking time out of your busy schedule. And I know that you all at the Detroit Health Department, you have our best interest for the Detroit residents. And I personally, as a long time born and raised right here in Detroit, I thank you for all of the work that you do. And everyone here at Ask the Messengers thanks you for the work that you do as well. And we just really, truly appreciate you very, very, very much. Just know that. So
thank you so much for having me.
Thank you so much. Until next time, there's the information right there on the screen for you. As she said, get educated. Trust the trusted resources, which is the Detroit Health Department, not Facebook, not Twitter, not TikTok, or whatever other social media you use. Go to the source. So that way we can get back to life, get back to normal, and we can be safe right here within our city that we love, love, love. Until next time, this is Tina Nelson. Again, Denise, thank you so, so much for being here with us today.
Thank you again. This was great.
Well, that concludes this week's episode of the Ask the Messengers TV show. We hope something you heard today helped you in some way to understand addiction and to give anyone struggling the desire to surrender and seek help. If you or someone you know is experiencing anything that seems to be too hard to handle, please know there is a way out, and don't hesitate or be afraid to seek help. Until next time, may you seek a power greater than yourself so that you too can turn your mess into a message that will help save lives. Continue to stay safe, and most importantly, be kind and love one another.
Won't you help us to do exactly what our motto is, and that is to help save lives? Won't you send a generous donation to the information there on the screen? We would love to have you as part of our partnership to help save lives. You may not be able to go out in the street, you may not be able to come here to the show, but you can send your donation that helps us save lives.